Hello, everyone. We are the Mathematical Epidemiology Research Group at Sonoma State. My name is Serina Cabrera.
My name is Dirk Tolson III.
My name is Geoffrey Knoll.
And we are presenting on our last semester's project, Mathematical Models for COVID-19. Now, some background information on COVID-19, which is SARS-CoV-2, a severe acute respiratory disease, where the origins of COVID-19 came from bats, where the first cases were recorded in Wuhan City, China, and the first death was recorded in January 2020. Before researchers and scientists classified it as COVID-19, it was classified as 2019 nCoV. This virus can spread even if the infected person doesn't show any symptoms. These are called asymptomatic infections. As of October of 2021, the California Department of Public Health identified 4 variants of concern: Alpha, Beta, Gamma, and Delta. And currently we are experiencing the Omicron variant as it is more contagious. This does impact how the treatment for the viruses and the vaccine response. For vaccines, as of October 25th, 2021, there were 53.8% of the total population in the US that were fully vaccinated, 68.1% fully vaccinated in California, as well as 82.2% at Sonoma State. As of February 8th, 2022, there were 64.2% of the total population in the US that were fully vaccinated, 70.2% in California, and 94.8% at Sonoma State. So comparing the different percentages, we can see that each percentage has increased within less than 4 months in between. As everyone knows and can see on the picture to the right, there are 3 different types of vaccines: Pfizer, Moderna, which both require 2 shots to be fully vaccinated, and Johnson & Johnson, which only requires 1 shot to be fully vaccinated. In our model, we do not differentiate between the different vaccines, but we do assume that you have gotten a full dosage with the respective vaccine that you've chosen. At the time of creating our model, it was not required to be boosted. So later in the presentation, it will be mentioned on how we will be moving forward with our model in regards to being boosted.
With regards to how we built our mathematical models, the model we built was based on a standard SEIR model, which consists of 4 categories: susceptible, exposed, infected, and recovered. In the base SEIR model, if members of the susceptible population come into contact with an infected person, they are moved into the exposed population category. A certain proportion of the exposed population will then move into the infected population, who will in time move into the recovered population. Our model functions the same way as the standard SEIR model, although we've added 5 categories: an asymptomatic category and a separate track for vaccinated populations, which includes exposed, asymptomatic, and recovered categories. And for the model equations that we use and the parameters we use to fill those model equations, you can see that we have a corresponding equation for each of the categories we had in the flowchart in the previous slide. To build this model, we used a system of 9 ordinary differential equations, or ODEs, to make this model work. We also had to establish parameter estimates that are particular to COVID-19. Thankfully, there's been a great amount of science that's been done over the last 2 years on this disease, and we use some of these sources in our estimations. We ran our model over 7 different levels of vaccination, and you can see on a screen here that it starts at 0, it goes to 25, 50, 66%, 75%, 90%, and 100%. And as the vaccination level rises, we notice that the number of symptomatic cases falls, but the number of asymptomatic cases rises. Therefore, it seems that even if you have up to 90%, of the population vaccinated, there will still be positive cases, even if the majority of those will be asymptomatic. This helps to explain why masks and social distancing are still effective public health tools, even as a larger proportion of the population continues to get vaccinated.
We collected data from the SSU emails and the SSU COVID-19 dashboard to graph the number of cases for each day to detect the spikes and different rates of change for each day. This data only counts for the number of positive cases for students on campus. There have been a total of 120 students who have tested positive on campus. but the positive case data is underreported due to how some positive cases are not reported by all students. Students that test positive off campus are not reported, and the amount of traveling that happens. Off campus, there have been a total of 299 student cases, accumulating to a total of 419 student cases overall. SSU notifies all students and employees where there is a positive case on campus. SSU also has its own testing center, so community members can get tested for COVID-19, specifically PCR testing. And then with the infection rate, to give context, back last year, the fall 2020, spring 2021 semester, when there was no vaccine or the vaccine wasn't released yet to the public, it was a 4.0 infection rate. And then for fall 2021, this past semester, the infection rate was 2.4. And then we also noticed in this graph that there was a spike in the January during the time when everyone was on their winter break. Between January 7th and January 28th, there was a total of 29 infected students, averaging to a case rate about 5.5. So that shows you how much of a big spike it was during that winter break. And then next slide. With COVID-19 putting most universities in a virtual learning environment, Sonoma State had all their students transition to online learning in March of 2020. With the start of the fall 2021 semester, classes were 47% in person or hybrid. 60% of all students had at least one in-person class. Currently, this semester, 70-75% of classes are in person this semester, and it's likely will increase after this year, after the semester ends. This semester, all classes were currently online for the first 3 weeks, with the exception of the classes who filed for exemption. After the first 3 weeks, however, most classes are now in person, and now likely in what it is right now. And for future work, we plan to update our model moving forward to incorporate those who are boosted, as well as to add important categories of disparities like gender, age, and race. We also plan to adjust our specific rates as regulations and policies are changing in Sonoma County, like no mask mandates. We plan to create mathematical models that reflect more specific to the Sonoma State environment with added factors. We're also working on creating in our group of adding a variable for immunity that will change over time. And that is our presentation. So thank you so much. Appreciate it. Done.